So there are a ton of moving parts in healthcare right now. A few of them are, what's happening in DC with the election results, change in the cost basis of care, a transition towards distance and digital health. And one could be worried or concerned that we need to know everything right now that's gonna happen in order to be successful in 2017. Fortunately, we don't need to do that. So what we know is that really great care, high quality provided at an affordable cost never goes out of style. We're not under enormous pressure to make changes in our cost structure tomorrow, but we know that's coming and it's going to happen over time. There are a lot of moving parts in healthcare right now. What I know is that if we stick to the basics, and for me, those are safety, quality, patient experience, great access, and stewardship, we'll be fine. There's an increasing drive for digital health. We know that consumerism is actually a huge push, and patients are really appropriately demanding not only great service, but also an empathetic and warm touch. Managing intensive care over distance may seem cold, but if you look at the big picture, patients are actually able to stay in their communities, near their families. So I think this is an example of how you can actually inject technology in distance health, etc., but not lose and perhaps even augment the patient's experience. Population health in this era is largely about disease management. And I talk about getting upstream and into the community to prevent disease and actually to create healthier, more vibrant communities. Economically vibrant, socially vibrant, ecologically responsible with good sustainability, as well as creating infrastructure and programs to actually keep people from getting the chronic diseases which are the plague of our society. I think we execute on them extraordinarily well, and if we can help others execute on them also, it's to the betterment of our society, from very close to home to very far away. So I'll continue to look for opportunities for us to make these contributions. And let me tell you, we'll get at least as much out of these interactions as we will give. We all need to focus on access. We can't help people who can't get in to see us. A lot of our new patients are millennials, and they have very high demands and very reasonably high expectations of us from what is the consumer experience going to be like. Patients want transparency. They have increasing amounts of skin in the game, and they just want to know, so what's my financial responsibility? The social determinants of health are at least as important in many instances as what somebody's physiology is. The idea that cancer is treated by standard protocols that are not informed by the genetics of the tumor and the characteristics of the person is going to be completely outmoded. So I think the lines are going to get very blurry around, what does a doctor need to do? What can a nurse do? What can lay people do? I think that we're living in the most exciting time possible. I think this next decade is going to see the most rapid change in how healthcare is delivered, with stepwise improvements in health for the population too. These are good times.